Hi, my name is Dr. Amy Spoelstra, and we are here talking about some of the biggest challenges that we have as chiropractors when working with kids and adults with neuro-deflective disorders or behavioral, learning, and socialization challenges. Now, one of the biggest challenges that I see is that we have so many people saying, hey, we don't treat symptoms, we're not treating deficits, but then because we don't know enough about brain development and what we do to impact brain development, when it comes down to it, we have people saying, hey, I found this primitive reflex that was unintegrated, or I see this deficiency and I want to treat it, or I want to do vestibular work because I notice that this is off in this individual. And the problem is we start chasing down these different paths without knowing that these are clues. Unintegrated primitive reflexes, oculomotor or eye movement, aberrant eye movements, visual cognitive challenges, behavioral challenges, processing challenges. These are windows into the brain. These are windows and clues that help us put together a whole to part, big picture understanding, comprehensive understanding of what's happening with this patient. And when we take it like that, as opposed to looking at it and saying, hey, we have this clue here, this unintegrated primitive reflex, or we have this aberrant eye movement issue, and we start chasing those down and giving exercises and doing exercises before we really understand the big picture and how all of those are giving us clues into the whole picture for this patient, we can run into some big challenges. Now, I understand that it's very tempting if you see a primitive reflex, or you see a nutritional deficiency, or you see, an aberrant eye movement, or you see these different things. It's very tempting to say, hey, we should start doing work in that right away. The problem is, not only could it not be very advantageous or helpful to the individual if we don't have it in the right order based on the whole picture, but you could make things worse. You could actually create more stress in that individual and cause more deflection because we haven't done things in the appropriate order. So I know that's a difficult concept, and I know it's a frustrating concept, but when you take the time to take the complexity of this, boil it down into something that's very simplistic as we can make it in our understanding of there's a way the brain goes through development, and if we have deflections along the way or stressors along the way, leaving gaps, leaving deflections, those are going to leave clues. We have to know how to take these clinical clues in the case history, in the presentation, in the deflective behaviors, and in our objective measurements and exam. We need to know how to take those, put them together to form a big picture, and then work clinically whole to part. Then we can start breaking down the pieces and knowing what we need to do. So I caution you to start jumping in and doing some of these pieces before you really have a firm understanding of the whole, the bigger picture, and then start going from there. Remember, we have an amazing ability to make a huge impact in this population, and that is wonderful, but we need to know more before we act, not necessarily do more.